Dr. Shruthy Vaishali and I am heading the Department of Cataract and Biometry in Mahatma Eye Hospital, Trichy. So this is located in the southern part of India, which is a hub of education and institutional growth. So in our institute, we always focus on both academic excellence as well as clinical growth. So my preferred practice pattern is to go for lifestyle choice IOLs, which is basically encompassing the multifocal torics and the toric IOL. So why do we need multifocal torics? Why is this the need of the hour? So we all know that there is always a hesitancy in the initial days to step into the platform of multifocal IOLs for any practicing ophthalmic surgeon. This is the main reason behind this is the post-op surprise. There is always the chance that the patient might end up with a post-op residual astigmatism or a spherical error. So when you can overcome such a hindrance, then when you overcome such hindrances, you're going to have the confidence that you're going to provide the patient with an excellent outcome. The patients in presbyopic age groups always have a tremendous need for near as well as intermediate correction via glasses. So when you have the option of providing them with the post-op spectacle independence, you can always you should always put forth the idea to the patient when that technology of say Eyecryl ACTV or the Eyecryl ACTV toric, which is available for patients' benefit. So what do we do? How do we go about in selecting the patient for a multifocal toric? So we always make sure that the optimal biometry is done. You put the patient through a series of tests, validate their outcomes, and if you have a topography with you available, always make sure that you rule out the irregular astigmatism, and once that is done, it all lies in the technology of IOL that you are choosing. So if you have a good rotational stability in your toric IOL, the outcome is always going to be reliable and you can deliver what you are promising to the patient. So if you take a patient with the main problem which we have noticed so far is that the patient selection criteria always starts with an astigmatism of 1 or 1.25 diopters. But we would suggest that even if you're having an astigmatism of 0.75 diopters, always put the data into a toric calculator, which is already provided by the company and very user friendly. So you incorporate the data into the toric calculator, which has the posterior corneal astigmatism incorporated into it. Then it gives you the necessary IOL power, whether it requires a toric IOL or not. The main hindrance with multifocal IOL is that we always fear that what if the patient has a post-op residual astigmatism or a residual spherical error. But if your biometry and your pre-op workup is really good, you do not have to worry about that. And considering that you're going to do a topography ruling out any chance of even a form frustae keratoconus, the outcome is always going to be very good. So for any practicing ophthalmic surgeon stepping into the platform of multifocal or multifocal torics, Eyecryl ACTV IOLs are a very good technology IOL which can be used with a good predictable outcome for all the patients which are coming to the cataract OPD for a presbyopia correction.